Hey, welcome back to ICONOCAST. Today we're going to talk about something that 1 in 3 men deal with, but almost nobody talks about, at least not out loud. We're going to talk about ED, or erectile dysfunction, and I'm going to cover it in a way it actually deserves to be covered. Honestly, without awkwardness, and with real science behind every single thing I say. Now, most guys who run into this issue do one of two things. They either ignore it and hope it goes away, spoiler alert, it usually doesn't, or they get a prescription, pop a pill before the right moment, and call it solved. What almost nobody does is ask the question that actually matters the most. So why is this happening? Because here's what the research is very clear about. In most men, ED isn't just a bedridden problem. It's a signal from the vascular system. It's your body trying to tell you something. It's a proverbial canary in the coal mine, and it picked this particular way to get your attention. So today we're going to cover what that signal actually means, why it shows up when it does, and then we're going to go through every real treatment option, from the familiar pill to some genuinely exciting technology that, by the way, we're the only clinic in this area that offers. Right now, let's get into it. Let me start with a number that actually kind of blew my mind when I first saw it. In nearly 70% of the cases, erectile dysfunction shows up before a heart attack, not after it, before. ED comes first, and then cardiovascular disease reveals itself later down the road. A study of over 1,700 men found that those with ED at the start were twice as likely to have a cardiac event over the following 4 years. And 19% of the men with vascular ED were found to have silent coronary artery disease, a serious disease that hadn't caused a single symptom yet, zero warning signs except for the ED. So why does this happen? It comes down to the anatomy and the plumbing, literally. So the arteries that supply the penis are about 1 to 2 millimeters wide, while the arteries that supply the heart are 3 to 4 millimeters wide. So when arterial disease starts creeping in, when your blood vessels start losing their flexibility and elasticity, the smallest ones get hit first. The penis is essentially your first warning sign. It sounds the alarm before your heart does. Here's the biological mechanism, and I'll keep this very simple. An erection requires a massive release, something called nitric oxide, a chemical your blood vessel walls produce that signals the smooth muscle tissue in the penis to relax and let that blood just rush in. That's the whole hydraulic process. No nitric oxide, no erection. And here's where things get a little bit more interesting. A 2024 review in PMC confirmed that oxidative stress, the same inflammatory process that drives heart disease and atherosclerosis, directly damages the cells that produce nitric oxide. So the same thing wrecking your cardiovascular system is also shutting down your nitric oxide production. 2 problems, 1 root cause. Even the American Heart Association has formally recognized ED as an independent predictor of future cardiovascular events, which means that when a man walks in with his issue, a good doctor should be thinking about his heart just as much as anything else. Now, the point here is not to scare you, it's to reframe this. ED is useful information. It is an early warning system, and the men who pay attention to it early are the ones that actually get ahead of it. Before we get into solutions, let's talk about the causes, because what's driving your ED shapes how it should be treated. The most common cause of ED in men over 40 is vascular. Blood vessel dysfunction. The usual culprits are diabetes, high blood pressure, obesity, smoking, chronic stress, and not moving enough. All of these damage endothelial function through that oxidative stress pathway that we just talked about. The second biggest factor is hormonal. Now, testosterone doesn't directly run the hydraulics, but what it does do is make the penile tissue more sensitive and responsive to that nitric oxide signal. It drives libido, and it supports the overall hormonal environment that makes everything work together. A 2024 Cochrane review confirmed that testosterone deficiency is a meaningful contributor to sexual dysfunction, especially in men who are generally hypogonadal. And then there's the psychological piece. Anxiety, performance pressure, depression, which can either cause ED on their own or pile up in a physical issue that amplify it significantly. For most guys, it's not just one thing, it's 2 or 3 factors overlapping, which is exactly why one-size-fits-all pill rarely solves the whole picture. All right, so here's where we're going to get into the good stuff. Let's walk through all your options from the most familiar to the most advanced. I'll give you the honest pros and cons of each one, and we'll save what I think is the most exciting for the near end. The first option is medication, the pill. Sildenafil, tadalafil, Viagra, Cialis, whatever you want to call them. Most men start here. They have the issue, they go to their doctor, they get a prescription, Viagra, Cialis, they're generics, sildenafil, tadalafil. These are PDE5 inhibitors, and they work by blocking the enzyme that breaks down the chemical signal that keeps blood flowing into the erectile tissue. Basically, they extend the window for the nitric oxide to do its job. And look, they work. For a lot of guys with mild to moderate ED, they work reasonably well. Tadalafil comes in a low daily dose. That means you're not timing anything around a specific moment, and a lot of people appreciate that. There's even a 2024 meta-analysis showing that regular PDE5 inhibitor use was linked to significantly lower risk of Alzheimer's disease, which nobody expected, but it is pretty cool. But here's the honest truth about the pill. It's a manager. It's not a fixer. It does nothing to address the actual vascular damage causing the problem. It does not repair blood vessels. It does not rebuild tissue. The moment you stop taking it, you're right back to where you started. The side effects include things like headache, flushing, nasal congestion, and this is the big one. They absolutely cannot be mixed with nitrate medications. If you're on nitrites because of heart disease, PDE5 inhibitors are off the table. That is a serious drug interaction. For a lot of men, the pill is fine short-term bridge, but if you want to actually restore function rather than just rent it on demand, I think that most men do. There's a lot more we can do now. When men come into my clinic and we start talking about ED, the first thing I want to address is hormone optimization. This one's often overlooked in the ED conversation, but it absolutely belongs here. If your testosterone is low, and a surprising number of men over 40 have no idea that theirs is, that hormonal environment affects everything. Desire, sensitivity, mood, energy, all these things that are needed to be working together for a healthy sex life. Now, TRT alone won't fully restore erections if there's significant vascular damage in play. But here is a good analogy. It's like trying to run a race on a sprained ankle. You can limp through it, but fix the ankle first and everything changes. A 2024 Frontiers in Endocrinology meta-analysis confirmed that TRT improves sexual desire and supports overall hormonal foundation for sexual function. At Eros Vitality, we always run a full hormone panel before building any treatment plan. If low T is part of that picture, and it often is, it needs to be part of the solution. Next, we start looking at treatments that can actually structurally fix the problem. The first one I want to talk about is shockwave. Shockwave therapy was a real step forward in ED treatment because, unlike the pill, it actually tries to address the underlying issues. Focused acoustic shockwave delivered through the erectile tissue stimulates the growth of new blood vessels, activates local stem cells, and triggers growth factor release. You're essentially encouraging the tissue to rebuild its own vascular supply. The clinical evidence is strong enough that the European Association of Urology actually recommends it for men with mild to moderate vasculogenic ED. A 2024 long-term follow-up study showed significant improvements at both 1 and 2 years after treatment. These are very solid results. Now, here's something worth knowing if you're shopping around for shockwave anywhere. Not all devices are the same. There's essentially two types, focused and radial. Focused shockwave concentrates energy at a precise depth in the tissue, kind of like a laser. Radial shockwave scatters that pressure outward from the probe tip like a ripple in a pond. The energy basically dissipates, disperses, and loses intensity before it gets to where it needs to go. Now, a 2025 systematic review covering 16 years of studies found that focused shockwave outperformed radial on every single metric. The IIEF scores, erection hardness, all of it. Some radial wave trials perform no better than sham treatments. So if someone tells you they offer shockwave therapy, it's important and worth asking which type. From a comfort standpoint, focused is also much better. There's no thumping at the surface causing irritations, and most guys say it's entirely painless with zero downtime. Shockwave is a proven technology, but what I really want to tell you about is the newest technology that has just come out because it goes further. And we're going to talk about Apex RF by InMode. If you're looking for a single treatment, this is the one. Okay, this is where I generally get excited because Apex RF by InMode is a newer technology, and Eros Vitality is only clinic in the area that even has it. Not down the road, not across town, just us. So what makes it so different? Apex RF uses a bipolar radio frequency energy. It's controlled thermal energy delivered precisely to the erectile tissue. And while shockwave therapy is focused primarily on one thing, growing new blood vessels, Apex RF does two things simultaneously. First is angiogenesis, new blood vessel growth, which is the same benefit shockwave gets you. But secondly, neocollagenesis. This is the part that generally is new. Apex RF stimulates the remodeling and restoration of collagen inside the corpora cavernosa, the erectile chambers themselves. Here's why that second part matters so much. The collagen matrix of those chambers is what gives you structural ability to trap blood and maintain pressure during an erection. When collagen degrades, and it does with age, diabetes, vascular disease, all this, you can lose rigidity even when the blood flow is actually improving. Shockwaves helps the plumbing, but RF works on the plumbing and the structure. It's a more complete repair. So let's talk about what the treatment session actually looks like. The applicator is small and is non-invasive. It delivers a temperature-controlled RF energy, and real-time sensors keep that tissue at a precise therapeutic temperature between 41 and 43 degrees Celsius, while keeping the surface completely comfortable. Sessions are about 15 minutes long of time on tissue, total time about 30 minutes. A typical protocol is 6 sessions, typically once a week for 6 weeks, and that's it. And the results build over time, which is a good thing, because you're triggering a biological process of the angiogenesis and the collagen remodeling. Most men start noticing results within 2 to 3 sessions, but here's the exciting part, is after you've completed your 6 sessions, you're not done healing. You still have improvement for typically 3 to 6 months, with a peak of 12 months after the process, because that collagen remodeling keeps going. Now for a durability comparison. Shockwave therapy typically holds its results for 1 to 2 years before needing a maintenance session or considering one, because Apex RF also rebuilds the structural collagen, not just the vasculature. Early data suggests that the results may last longer. The research is still ongoing, but the biological rationale is solid. We're proud to have this technology. We were one of the first in the country to bring it to market. If you are in or around Sarasota area and want to access this technology, we are your only option locally. Now let's talk about the P-shot or the papyrus shot. We'll also cover the P-shot with Botox. First, the P-shot is a regenerative injection treatment. We draw your own blood, we spin in the centrifuge to isolate platelet-rich plasma, and inject this directly into the erectile tissue. Platelets are packed with growth factors that tell your body to repair and rebuild new tissue with new vessels. The 2024 systematic review and meta-analysis confirmed that PRP significantly improved erectile function scores across multiple randomized controlled trials. A 2023 placebo-controlled trial published in the Journal of Urology confirmed its safety profile. 2 injections separated by a month in men with mild to moderate ED. The P-shot works beautifully alongside Apex RF. They work synergistically. The RF builds the structure in the vasculature, while the PRP layers in targeted growth factor stimulation at the same time. Combined, they create a more comprehensive regenerative environment than either one does alone. We also offer the P-shot, enhanced with Botox. And before you start picturing forehead injections and silliness like that, let me explain something. Intracavernosal Botox works completely differently. In some men, the smooth muscle of the penis stays in a state of excess tone, or too contracted, which means it prevents the blood from flowing freely even when nitric oxide signals are working correctly. Botox temporarily reduces that excess tension, helping the tissue relax the way it should. A 2025 systematic review of 51 clinical studies found response rates between 40 and 77% with a very favorable safety profile. Mild brief discomfort being the most common side effect. Combined with PRP in the same session, you're hitting vascular repair, growth factor stimulation, and smooth muscle optimization all at once. I want to talk about supplements for a minute. Because of what I do, I get a lot of things on my Facebook, from magic pills to salt tricks to exercises, and I want to be real with you about supplements because the marketing in this space is completely out of control. Most of what is out there does nothing. But there are a few things with actual clinical evidence. First and foremost is L-citrulline. It is the strongest performer. It converts to L-arginine in the body, which is what your cells use to make nitric oxide. Studies support 1.5 to 3 grams a day for meaningful nitric oxide support. This is not going to fix a significant vascular ED on its own, but it genuinely supports the underlying mechanism. Penates ginseng, specifically the Korean red ginseng, is the other standout. A 2024 randomized controlled trial testing the combination of Pennex ginseng, the Tribulus terrestris, and L-arginine found significant improvements in erectile performance scores versus placebo. Multiple prior meta-analyses actually back this up. Bottom line on supplements is they can support the system and they do work alongside clinical treatment. But if you've got a real vascular dysfunction going on, no supplement is going to rebuild the blood vessels. They're an add-on, not a solution. Okay, now let's bring this all together. ED is not random, it is not inevitable, and it doesn't have to be permanent. It's your body communicating something real about your vascular health, your hormones, and how everything is working together. The men who take that signal seriously are the ones that come out the other side feeling better than they have in years. What I want you to walk away is this. There are real solutions. Medication has a place as a bridge. Hormonal optimization builds the foundation, but shockwave therapy helps rebuild vasculature. The P-shot and the Botox combination adds a power regenerative layer. And Apex by InMode takes the whole concept further by restoring both the blood supply and the structural integrity of the erectile tissue itself. None of this is one size fits all. The right protocol depends on your labs, your history, and what's actually driving your situation. That is exactly what a consultation at Eros Vitality is designed to figure out. The link to book is in the show notes. Come talk to us. There's no awkwardness, no judgment, just real information and a plan built around your biology. I will say one last thing. Getting treatment sooner for ED than later is utmost important. The longer you let this go on, the more damage occurs. And the more damage occurs, the more it takes to fix it. If you start to experience ED, come seek help first. If you start having symptoms of ED, please schedule a consultation fast. Thanks for listening to Eros Vitality Podcast. If this episode was helpful, please send it to someone who needs to hear it. Most men won't bring this up on their own, but the right information at the right moment generally changes things. We'll see you next week.